So, what can we do? Although the U.S. Food and Drug Administration has increased labeling for opioids for the pediatric population with what's called black box warnings, there continues to be an increase in prescription opioids written in the United States. Studies report a 33% increase in the risk of non-medical use of prescription opioids with young adults who were initially prescribed an opioid before the 12th grade. Early intervention, warning signs, and understanding the risk factors are really good starting points. But implementing a drug education program in schools significantly reduces the lack of opioid knowledge in young adults and decreases the likelihood of opioid drug use. There are 5 key principles that help us to learn and understand how to create a prevention program. We'll start here with Principle 1. Principle 1 tells us that a prevention program should enhance protective factors and reverse or reduce risk factors. This includes those risk factors we discussed earlier that are within the family and a child or teen's association with drug-abusing peers. Remember that early intervention for mental health concerns, aggressive behaviors, and poor self-control has a better impact than later intervention. As we develop a prevention program, Principle 2 reminds us that a good prevention program must discuss all drug conditions. These include legal drugs such as alcohol and nicotine, illegal drugs such as heroin, fentanyl, and cocaine, and prescription drugs like opioids and over-the-counter medications. In Principle 3, we learn that sugarcoating, or hiding the reality of what is happening in our communities, does not protect children from drug use or misuse. On the contrary, it leaves them vulnerable and naive. Principle 3 tells us we should discuss the type of problems occurring in the local community in prevention programs. What are the local risk factors? Can they be modified? We need to identify the protective factors and discuss what they are. Recall that protective factors include having a safe place to discuss drug use and misuse, engaging in extracurricular activities in and out of school, and having positive role models. Relevancy is imperative. It's important to tailor the programs to address risks specific to your audience, their age, their gender, and their ethnicity. This increases effectiveness. If you're fake, teens will know it, and you'll lose credibility. In Principle 5, we learn that it's important to include family-based prevention programs. These will enhance family bonding and parenting skills by developing family policies. A family-based prevention program should allow families the opportunity to practice these family policies. In addition, they must include training in drug education and information, teach supportiveness amongst family members, how to communicate, and teach parental involvement. Lastly, a prevention program should include the availability of Narcan, also known as naloxone. Free Narcan kits can be obtained for nurses in case of overdose during school hours. Narcan is easy to use and could save a student's life. More information is available on naloxone and how to obtain free Narcan and the resources provided.